Hi, I'm Dr. Andrew Nguyen from Columbia Pike Animal Hospital and Emergency Center. I'm here to speak to you a little bit about the ins and outs of veterinary orthopedics. Stick around while we get into some questions. The most common, I would say, is as our patients age, osteoarthritis. So general age-related changes into our joints that cause inflammation, pain, discomfort. And that pretty much affects all geriatric patients across the board. Now, if we get into more acute injuries, I would say the cranial cruciate ligament injuries, ACL injuries, are fairly common in our dogs as well. So this one's a tough one because our patients don't talk to us, and some of them are very stoic in nature, depending on the dog. So it can be as subtle and non-specific as just mild panting, slowing down a little bit on walks, hesitancy to do certain athletic things that they've done in the past without issue, jumping on the bed, getting up and down onto the couch. Certainly those are kind of the early signs and potential signs. If something is very acute and painful, you might see very obvious signs like yelping, vocalization, complete lameness, and obviously those are signs of discomfort and should be addressed. What we call in general chondrodystrophic dog breeds, and those are our dogs like bulldogs, Frenchies, and they've been bred in a way where their arms and their leg, the curvature of those bones are a little bit, or sometimes in some cases, very much skewed from normal. And that is just a product of how we've wanted these breeds to look over the years. However, is it the best conformation for them as far as biomechanics? Not really. And so those guys do succumb to earlier onset of arthritis because those joints just aren't mechanically normal. Sometimes they do succumb to certain injuries because those joints aren't normal. The other thing that we sometimes get with smaller breed dogs like Chihuahuas and Malteses, Shih Tzus, which is another chondrodystrophic breed, is patella luxation. So these patellas or kneecaps don't ride normally, and they kind of ride outside of the normal groove, and that can cause arthritis and injury in the long term. So those are the small dogs, as you can say. But in general, like large breed dogs, if we really have to be careful with those guys in arthritis, because say if you're small and you get arthritis, your owner can carry you around when you're 15 pounds, 10 pounds, no problems. And you can still live a very good quality of life with managed pain control as a small dog with arthritis. But our large breed Great Danes, unfortunately, sometimes that is the limiting factor for quality of life. And sometimes the only option is euthanasia because we just can't manage the pain. The dog can't get around. And obviously, you can't carry a 125-pound dog around and, move them around. So especially with those large breed dogs, I, on my annual examinations, always stress weights and, body conformation as being, as ideal as possible versus being overweight. Perfect segue, weight loss, good, body condition score, exercise. There's also medications like joint supplements, glucosamine, chondroitin sulfate, things like that may help. But I think the biggest thing, honestly, is the weight, and making sure that our patients, especially those chondrodystrophic breeds or the large breeds, to have an ideal body weight. Yeah, so I think that's the biggest thing. Thank you very much for joining me today. If you have any questions, concerns, please give us a call, shoot us an email, set up an appointment. I'd love to talk to you about ways to make your life and your pet's life better.